all the mammograms came back negative. Every single one, up into 5 days before I was diagnosed.
Susan Abar of Plano, Texas, followed the standard screening recommendations, but despite previous negative test results, was convinced something wasn't right.
In fact, I got a letter in the mail from the diagnostic center, and they said that there was nothing there. I didn't even call my doctor back about the biopsy. Finally, the nurse called back and said, Susan, we need to see you. We need to see you. And on June 13th, I went in, and the doctor came in and said, Susan, you have breast cancer.
Mammography is an effective screening method for breast cancer, although its exact benefits seem to vary by age. But one tool being utilized a lot these days, particularly for women who are at high risk for developing the disease, is magnetic resonance imaging, or MRI.
We're going to do your screening mammogram today.
The MRI examination is a tomographic image. In other words, slices of the breast are obtained in the image. MRI basically is more expensive than a mammographic examination, and it can be anywhere from 8 to 10 times the cost of a mammogram. And so it is reserved for women who are at high risk of developing breast cancer.
High risk is usually considered to be the situation where you have a very strong family or personal history of breast cancer, or the fact that you've been exposed to radiation to your chest as a child or a young adult. Mammograms are considered to be the gold standard in women who are considered to be at average risk. For women at higher risk, sometimes newer technologies and newer tools are needed, such as MRIs.
One other recommendation from healthcare professionals: ask for a second opinion.
If something doesn't seem right to you when you're discussing options with a physician, then it really may become important to you to get a second opinion. When a patient asks me, could I get a second opinion, I always encourage them to do that, but I always encourage them to get an informed opinion.
I exercise at least 4 times a week. I eat healthier. I still have my chocolates. And I'm proud to say it, next month I'll be 60, and I think I'm doing pretty doggone fine.
With News for the Cure, I'm Dr. Vladimir Lang.